I am Dr. Sujith. I'm an associate professor of respiratory medicine from CMC Vellore. And I was the co-investigator for the device validation study done between Salcit and CMC Vellore, where we used cough sounds and we recorded cough sounds on the mobile app, the Swasa app, with the aim and objective of trying to diagnose certain chronic lung conditions like asthma and COPD. So I understand that there are some concerns about possibility of transmission of infections between patients, from patient to healthcare professional, and it is a valid concern. But I'll tell you the steps we have taken to address it during the study. So the healthcare professional at the time of recording of the cough sounds has to wear a surgical mask and surgical gloves. The patient is instructed also to wear a surgical mask, and there is a fixed distance between the healthcare professional and the patient. And also there is a standardized distance recommendation for the patient to hold the phone as well as the angle of the mobile phone while recording the cough sounds. After the cough sound recording is over, we instruct the patient to use alcohol wipes to wipe the mobile on which they have recorded the cough sounds, and then it is handed back to the healthcare professional.